I'm struck by the all walk, and I know this comes up in your book and elsewhere, and you've done a lot of research on this. For those listening, what would an all walk look like, and what are some of the health benefits? You just mentioned a few that have been observed both in the short and the long term.
Yeah, thank you. We are a walking species. It is just in our DNA to walk. We meandered from Africa to all the continents. A lot of people, Rebecca Solnit writes about this, like walking is almost sacred. It's a kind of consciousness. Like you're saying, like, whoa, I'm picking up a vaster view of what's around me. And I decided to just create this all walk, and I did it for a meditation group or Mindful Magazine. You just slow down. A lot of people walk. Hundreds of, tens of millions of people have regular walks in the United States. It's good for you, so we just add it all. Like on your regular walk once a week in our study, go somewhere you wouldn't ordinarily go. Go someplace that may surprise you. I walk around Berkeley a lot, and I was like, well, I'm going to go past the little playground that my daughters played at when they were young and just feel that, Cordonesi's Park.
Yeah, with the rock slide and the tunnel.
Exactly.
I love that place.
Near the Rose
And
Garden.
there's a secret, should we give this away?
Yeah.
There's a secret hiking trail it's actually through a private property's backyard,
Yeah.
and they allow you to go through if you are quiet and you pick up your trash. And there's an incredible waterfall and place to stand at the top. There's a beam there. You've been there, I'm sure.
Yeah, I know.
Where you can look out over this, what is kind of like a trench of tree. It's a total transformation of one space to the next.
It is.
If you look for it properly, I'm sure now it's on the internet. It's in kind of swinging gates, not locked. And
still hard to find.
And there's a little monastery maybe nearby,
Yep.
and you might see me. A couple years ago, you would have seen me and my dog, but you might see me eating a slice of pizza from the cheese board, sitting on that log. I spent a lot of time there.
I'm getting goosebumps, Andrew. That is just pure Berkeley. Thank you.
Yeah.
So in this study, all walk. Go on your walk. Find a place that's going to be a little surprising, where it may make you feel a little bit of childlike wonder. And it's interesting. No one's asked me this question, your observation about small to vast. And we just said, slow down, deepen your breathing, sync it up with your walking, which you've studied empirically, the breath. And then go from small to vast. Look at clouds, look at the whole pattern of clouds, just slow it down. Look at trees, look at the light on the trees, and look at points of light and then patterns of light. Look at, I love walking past playgrounds. It's one of my favorite sources of awe. Listen to one laugh, and then listen to the whole symphony of laughter of kids, right? That's all. And they walk through, they do that for half an hour. And what we find in that study is they become more vast in their consciousness. They're more aware in the photographs that they provided of what's around them. They feel more kindness over the 8 weeks. They feel more awe over an 8-week period. It rises. And then the finding that was, important for people who are elderly is less physical pain. Your body starts to ache when you're 75, or earlier. And awe, I think, through the inflammation process, and reducing it, caused less pain. This dovetails with other health benefits. Awe is good for reduced inflammation, elevated vagal tone, reduced long COVID symptoms. We have people with long COVID, just a minute of awe a day, reduce long COVID symptoms. It's good news, right? And there's so much science on it that now I think medical doctors are starting to think like, I'm going to prescribe nature, I'll prescribe music through awe, right, as a mechanism.